Hey guys, it's Erin, and today I'm going to be talking about some suicide statistics with veterans and then talking about some things that influence those statistics. And I want to start by telling you guys that the 2019 National Veteran Suicide Prevention Annual Report is where I'm getting this information from, and it's from the U.S. Department of Veteran Affairs. I'm going to start with saying that the number of veteran suicide deaths per year has increased from 5,787 in 2005 to 6,139 in 2017. The annual number of veteran suicide deaths has exceeded 6,000 since 2008. And from 2005 to 2017, the age and sex adjusted suicide rate for the overall US population has increased from 14.7 suicide deaths per 100,000 to 18. It's also worth noting that the age and sex adjusted rate for the veteran population increased from 25.7 suicide deaths per 100,000 to 27.7 from the year 2016 to 2017. Now, that's not statistically significant. However, the adjusted suicide rate for veterans increased significantly from 2006 to 2017. It's pretty evident that the number of suicides has increased among the veteran population over the years, especially since 2005 to now, when this report was given in 2019. And I just wanted to talk about some of the things that have influenced that. And the first one I want to talk about is sexual dysfunction. It's common in people with post-traumatic stress disorder. In a 2020 study led by researchers with the San Diego, Virginia healthcare system, a team assessed 138 veterans and their partners before they began couples-based PTSD treatment, and the assessment showed that in male veterans, decreased sexual pleasure and decreased frequency of sexual intercourse were linked with more recent suicidal thoughts. In female veterans, increased sexual frequency was marginally linked with increased suicidal thoughts, and the researchers stressed the importance of assessing sexual function as a risk factor for suicide and suggested therapists should consider the possibility that sexual functioning may be protective or predictive of suicidality depending on the person being treated and the context of the situation. Another factor worth noting as a factor of suicide amongst the veterans population is post-TBI symptoms being linked to suicide. Having a traumatic brain injury can be detrimental, and having symptoms before deployment is associated with an increased risk of suicide attempts. The research team studied data on 7,677 soldiers deployed to Afghanistan in 2012. Of these, 103 had attempted suicide. The team found that the soldiers who had post-concussive or TBI symptoms prior to the deployment had a much higher risk of suicide than those without the TBI symptoms. So having a traumatic brain injury is definitely a risk factor that can affect some of these statistics in veterans. It's also worth mentioning that the social determinants of health is linked with suicide. And what I mean by that is the 7 adverse social determinants of health would include violence, housing, instability, financial or employment problems, legal problems, family or social problems, lack of access to healthcare and transportation, and non-specific psychosocial needs. It's important to note that anxiety and depression are big factors within the social determinants of health. And in a 2019 study, a team of researchers with the Syracuse, Virginia Medical Center found that 40% of surveyed veterans with anxiety had at least one risk factor for suicide. This definitely can influence the statistics on veterans. And also, the researchers found that suicide risks were more common in veterans who also screened positive for depression than those who had anxiety just alone. However, the severity of anxiety symptoms did not affect the veteran's suicide risk, and this is definitely worth noting. Another factor I'd like to mention is the possible link between low cholesterol and suicide amongst veterans. Researchers at the Coastville, Virginia Medical Center in Pennsylvania found that lower cholesterol levels may be a biomarker for suicidal behavior. The 2017 study results indicated that veterans with total cholesterol levels below 168 appeared to be at a higher risk of suicide than those with higher cholesterol levels. The researchers examined that the medical records of 120 veterans who received care and who were included in suicide prevention databases. Veterans in the study who experienced suicidal thoughts or attempts had cholesterol levels that were significantly lower than those who did not, and further analysis found that veterans with suicidal behaviors were much younger, leaner, and had more anxiety with more sleep problems, and also had higher education than those who were being seen for a health issue unrelated to suicide. The researchers cautioned against making a definitive link between those factors. However, they do consider it a potential risk. Now, this is all relevant because all of these statistics definitely have an impact based on different risk factors. However, it's definitely important to note that having post-traumatic stress disorder is a big factor to having a suicide risk. And that's what I have for today. Thank you for listening, and God bless our veterans.